Good afternoon. So today in the series we are going to discuss about pain and spasticity. So as we all know that in this generation, stroke is one of the condition which has been impacting a lot of individuals. So among this, the one type of stroke which we are going to discuss about is spinal stroke. So spinal stroke is nothing but in simplest form that it is causing a stroke in the spinal region. So as we have the blood supply to the brain, blood supply to other systems, we also have the blood supply to our spine. So when there is suppose a clot or a hemorrhage in terms of something called as a bleed. So in that cases again there will be a stroke at the spinal area. So let's start with the pain first, one of my favorite topic until now and which I have been discussing very frequent in different types of conditions in these series. So when it comes to spinal stroke, what type of a pain will you feel? So this time we are not going to classify anything for the reason that when we get a condition like this, there will be pain and it will be sudden in nature with different symptoms. The symptoms of pain will be sudden in onset, it will be sharp shooting in type. Sometimes also it will be mentioned as someone has hammered immediately. Along with that later it will be after few half an hour or more than that, they will present like burning like sensation all over or sharp shooting type or tingling type of a sensation. So when these pain perception will be is accompanied by your other symptoms, which includes your sensory motor symptoms and which are sudden in onset, these are the classical alarming signs that they need a medical attention immediately. So when I say sensory motor symptoms, it will be again weakness, sensory impairment, and you say in terms of incontinence or be it bowel bladder incontinence, and also at times fall post stroke, spinal stroke. So these are some of the classical things which we need to address it and get a medical attention immediately. Now coming to the spasticity. Spasticity, definitely it is seen in brain stroke as well as in spinal stroke. So when there is again, if you would have heard about the spinal conditions, you will also be knowing about something called as leveling of the spinal injury. So be that injury can be in terms of traumatic, non-traumatic, or in non-traumatic, again this is one of the condition, that is spinal stroke. So initially, depending on how bad it is, be it say Asia level A, B, C, D, E, again the spasticity will appear. Now coming to spasticity, so what is spasticity? Again, a muscle works normally or a muscle tone function normally when there is a co-contraction from either of the muscles, and that is how a movement is produced in a smooth manner. But when there is a disruption between the signals or the circuits from the other centrals which control the movement of our body, then there will be spasticity appearing. So spasticity is something which is not normal. Again, it is velocity dependent. Basically, there will be muscle contraction and relaxation will not happen in a normal pattern. So what happens now in spinal stroke? Suppose a patient has got a spinal stroke and present with you in an acute phase. So initially we do have to do a very detailed assessment on how to assess what are the presentation, what are the clinical features. So initial stage, at times most of the cases presents with flaccidity in something called a spinal shock. So when patient is in a spinal shock, they will present like there is no tone at all. When I say no tone, so if it will be very like when we lift the leg, it will be very free. It's that there is no control from the body to that extremity. It will present something like that. But when there is a recovery happening, something you might have heard of neuroplasticity. So as we mentioned before about the severity of the condition, so when there is a recovery happening at the area of damage, some part of the nerves will be completely damaged and some part of the nerves will be spared and some part of them will be partially damaged. So when they work with the phenomenon, they work with the theory of neuroplasticity, the recovery starts to happen. Now when this recovery is happening, the spinal shock phase is over. After the spinal shock phase is over and then the spine, something we call as spine recovery happening, the spasticity starts to appear. So initially the spasticity, as a therapist, it helps us. How does it helps us? This spasticity will help us in initiating the movement in the extremities which were involved. So that through that we can help in getting some amount of movement, but definitely it will be not completely controlled by the patient. It will be say around 10% of initiation or say maybe 5% of initiation will be there, but rest will be spasticity or rest will be because of the spasticity component. So in that phase, when we explain to the patient or when we explain to any layman person, we say it as a something called as good spasticity. Now there is nothing as such a good spasticity or a bad spasticity, but we as a medical team, we refer to it for the explanation purpose to understand where is the fine line between spasticity to inhibit it and where we can take the help from it and explore more of movement within the extremities. Now coming to how is this progressing. So the spasticity has occurred, it is helping us out, but at sometimes there will be extreme firing from the muscles that will lead to more contractions, that will lead to more spasticity. So that where it will stop us from doing proper therapy strategies. So that is when that is actually the right time for us to take help from the medical team, how we work like a transdisciplinary aspect, and then go with the medical interventions. Now before going into the medical intervention, I would like to share with you why the spasticity happens. So if there is a normal circuit in your house, if you have a normal circuit, from when you switch on the light, the bulb glows. But if there is any chance that the wire is disconnected partially, there the bulb will start flickering. So the same mechanism happens in our body also. So similarly it works with our system also. So if the nerves are involved, be it completely damaged or partially damaged, there will be abnormal functioning of the muscles at the periphery happening. So that is how the spasticity works. If and then in the specifically in case of spinal stroke, the presentation in most of the cases will be like initial state of flaccidity when there is a spinal shock phase, post that recovery when spasticity starts appearing, and then extreme spasticity. What next to be done? So now if say suppose we are going for the rehabilitation and we are not able to do any of the treatment strategies for the reason that spasticity is hampering our strategies, then we do a detailed assessment, which again you all might be knowing something called as different objective scales which we use for the spasticity assessment, something like modified Ashworth scale or Tardio scale, to differentiate whether it is a pure spasticity that is hampering our treatment strategies or any other involvement is there. But all these things, all the management which we have mentioned about, every step is taken all together, be it a rehab team which will help which will help us with the assessment, the right decision to be taken in terms of medication, whether medical management in terms of tablets to be given or injections to be given or pump has to be implanted. All these decisions are taken all together. Finally, the outcome will be improvement or in patient care. So thank you for watching, and definitely don't forget to subscribe to our channel and stay tuned.